Dr. Venkatesh Rajkumar, consultant nephrologist at Apollo Hospital, Chennai. So let's discuss a little bit about kidney diseases today. So kidney diseases has become very common nowadays, that too with the increasing prevalence of lifestyle diseases like diabetes and high blood pressure, hypertension. Kidney disease, the prevalence has increased dramatically. The problem with the kidney disease is that most of the times the signs and symptoms are very, very subtle. So unless and until it is very late into the disease, patients do not have much symptoms. And by the time they start having symptoms is already a little advanced. So the idea of treating or rather preventing kidney disease is to pick them at an early stage so that we can do something to prevent the progression, at least if not to cure it. So there are a lot of easily available tests available even in a primary health center which are not very costly, which you can do it in the blood, urine, as well as a few scans you do in the abdomen to diagnose kidney diseases. For example, you can do a urine routine microscopy, you can do a blood test called serum creatinine, which can tell you about the kidney functions, and you can do an ultrasound of the kidney. So these are the commonly done tests to diagnose kidney function, to diagnose kidney issues. So they can give an idea about the kidney functions. If they are deranged, you need an evaluation for that. And who are the candidates? Where should you be doing all these tests? So kidney diseases have become very common primarily in those with lifestyle diseases. So those are going to be our target audience, primarily patients with diabetes and high blood pressure. So they should undergo these tests at periodic intervals, at least once a year. You can do a simple urine microscopy, or you can do a blood test called serum creatinine. You could do a kidney scan to find out if the kidneys are functioning properly. If the results are normal, you can repeat those tests at a periodic interval, say once in a year. On the other hand, if there is any abnormality in these tests, you should meet up with your nephrologist, and you can even try to reverse the diseases, or you can at least prevent the progression of these diseases. For example, in kidney disease due to diabetes, the main treatment will be to control your diabetes. Similarly, in patients with kidney problems due to high blood pressure, containing your blood pressure will be the most important thing to prevent progression of kidney disease. As far as the signs and symptoms of these kidney diseases are concerned, you should know a little bit about the functioning of the kidneys. The kidneys, they carry out a lot of functions, but the important ones being a regulation of your blood pressure, excreting toxic waste from your body, and maintaining your hemoglobin level by producing a hormone, again maintaining your calcium and consequently your bone health by producing your hormone. So these are the important functions of kidneys, to name a few, and consequently patients with kidney diseases will have problems related to these issues. For example, high blood pressure is one of the common signs of kidney disease. Patients with kidney disease or not have low hemoglobin anemia. Similarly, patients with kidney disease have a poor bone health. So these are the common things, and in addition to them, most of us will be knowing edema or swelling of the body. This is again a common feature of kidney diseases. So these, but as I was discussing earlier, by the time patients start having these signs and symptoms, patients have progressed to a little advanced kidney disease already. So the idea is to pick those kidney diseases at an early stage, even before patients start manifesting these symptoms, so then you can try to reverse the kidney diseases. Thank you.